to go on to the HACCP, basically what HACCP is the same as what in industry is called a safety case. And this is basically, it's a structured and documented body of evidence providing a convincing and valid argument that the system is adequately safe. And it asks questions, the document, it's structured, but it asks questions like what could go wrong, how bad could it be, what's been done about it, and what if it actually happens, what's your, how do you sort out the problems that appear. And basically, HACCP was invented as a consequence of space travel. And it was invented by NASA, the US Army, who has a food lab, and a food company called Pillsbury. They got together because the concept of astronauts having diarrhea in zero gravity just couldn't be entertained for a minute. So they worked this up in the 1950s and 60s, and it is now the international system for delivering food safety, particularly from a microbiological point of view, exactly the same as delivering a safe environment in a hospital, except this is delivering a safe environment in a food factory or what have you. But the principles are exactly the same. There's a bit of a problem with basically when you get into complex situations like space travel. They have had diarrhea in zero gravity, but it wasn't due to food poisoning. It was due to the emulsifying factors in the food that they asked to get it's like toothpaste out of a tube when you're in zero gravity. And they decided to change that, and some of the astronauts got loose bowels, but that wasn't anything to do with the safety side of it. But of course, we've had problems in space travel because the safety case, which is the equivalent, wasn't done properly in space travel. And I'll finish by saying exactly what happened there. The safety case, if you want to read about safety cases, read the public inquiry into the Piper Alpha disaster, which happened in July 1988. Now, from Aberdeen, I remember hearing the helicopters coming over. It woke me up in 7 o'clock in the morning, 6:30 in the morning, coming in from the platform into Aberdeen. Unfortunately, there were only 2 helicopters came in from the platform because everybody on board, 160 plus people, died. And this is the point when most of them perished because they were waiting to be rescued in their accommodation module, which, a great pipe full of methane gas blew up underneath. The problem about this, and the reason why I'm bringing it up, is that as a consequence of the Piper Alpha disaster, Lord Cullen, who did the public inquiry, recommended that the offshore oil industry should have a structured way of delivering safety, just like the HACCP in the food industry, just like the best systems for preventing healthcare infections, where you look at what the problems are, you dissect out what the problems are, and then you work out your salvation around those problems, how to prevent those things. And of course, with healthcare-associated infections, how to interrupt the transmission of those bacteria and those viruses that are causing problems. What are the best ways of interrupting transmission? How can we deliver them? Write it down, and how it can be, by monitoring, how can we be sure that we are actually delivering those aspects to protect the patients? The other moral of looking at Piper Alpha was that you can't rely on external assessors, inspectors. They're a vital part of the system, but Piper Alpha had been inspected 12 days before it blew up, and had been given a clean bill of health by the inspector, and he spent a whole day there going around looking at it, but he failed to see 1 or 2 obvious things. And the problem is not just spending a lot of money on working out your plans either. If you want to find out, look for an example of how not to do it, read the inquiry that came out last October on the Nimrod disaster, where this plane went down over Afghanistan, over Helmand province in Afghanistan in 2006. Now, there are all sorts of issues here that, this plane was essentially, the design goes back to the 1940s, the Comet airliner, and it was jazzed up, and this plane came into service in 1969, so the RAF calls it a legacy aircraft, But the RAF decided to have a safety case analysis and write a document saying how we could run this plane safely. And they spent £400,000 on it, but it missed out so many of the essentials that basically it's not a question of the money was spent, it wasn't spent very wisely, it didn't spot the essential problems. And for me, the moral is that unless we understand the bugs that cause hospital-acquired infections and work out how they're transmitted, and that's often one of the areas where we have the least solid evidence. How does a patient get an MRSA infection, for example? What was the event that led to somebody becoming, having C. diff colitis? It's often impossible, usually impossible, to pinpoint the actual thing that went wrong or the route of transmission. But what we have to work out, we have to do our best to work out basically what is happening across the piece. If we can do that, I think we have a much better track record in terms of preventing infection. Some of these things we may come up with as solutions might be very expensive. We may decide that it's far too dangerous to have patients who are excreting organisms like MRSA and C. diff in an open environment where they can infect other patients, for example, and that's, of course, the benefit of isolation, plus all the barrier nursing that goes along with it and so on. But we have to look at that very, very carefully and come up with basically the safety case to prevent hospital-acquired infection.